So, I mean, the first session was quite interesting, and we had to look at sex, STI. Dr. Owoeye is looking at me like I'm talking about this thing too much.
Yeah.
Okay. I'm going to reduce the intensity on the sex.
Exactly.
Okay.
Sex all the time.
Yeah. So we spoke about the STIs and how it's transmitted and a few other things about exposure, treatment, and all of that. But then again, want to talk about something very important about STIs, the importance of early testing, because people keep going, and because these things the symptoms don't pop at you immediately, and maybe you just went to see Uncle John today and tomorrow you're itching already. Or maybe they do, and you just feel like, you know what, I'm still going to see Uncle John till next week, so maybe let me finish the course and go later. Or you just feel like, oh, since I'm not having any symptom and I'm going on vibes and inshallah, I mean, it's all good. And then you wait and years, months turn into years and years roll into more years, and you don't get tested and subsequently treated. So, I mean, why is early testing, Dr. Tade? Why is early testing or early detection important with STI management?
Well, there are different STIs. Yeah. So, different STIs, they result in different complications.
Yeah.
So generally, you want to find out if something has gone wrong, right?
Okay.
Right after you've had an episode of unprotected sex, and that is really important because you want to ensure that you know about your body, you know what your body could have, what you could have gotten from anyone.
Okay.
And it's especially important because you want to treat early. Right?
Okay.
So you want to find out what could be wrong. And then you want, take the very next step to avoid transmission to someone else. I mean, we're talking about sexually transmitted infection. So you want to avoid, passing the same infection to someone else. There's no other way.
There's no other way. That's good to say. Yeah. Dr. Owoeye, do you want to contribute to that? Yeah. Why it's important to detect early?
Yeah, I quite agree with him. But also I think that one of the things that make it very important for you to detect early is because most of the sexually transmitted infections outlined, they are asymptomatic,
Dangerous.
So and that's very dangerous. So because they're asymptomatic, it has implications on your health and on the health of your partner. You understand? So for you, if you are asymptomatic, well, you're not likely going to actually feel the need to actually run a test or something. And then the disease will continue to progress, and then there will be complications. Then for your partners, because you're asymptomatic, they would say, I could remember this day, they would say, sorry, I'm just going to use AIDS because it's not just AIDS. They say AIDS, they show for face. So STI, they show for face. So you look good, you look nice, you look presentable. There's nothing wrong with you. You look clean. So yeah, your partners are quite happy and like, oh yeah, she's a clean girl, not knowing that she's actually a baggage or is a clean guy, not knowing that he or she is a baggage of, infections. For me, I think it's very, very important for you to actually detect STIs early.
I think what you said now that makes a lot of sense is the fact that people feel like they can look at someone and assume that they have an infection, You see glowing Dr. Ofem, when you look at her, you're like, she's too clean and smooth.
Yeah.
But then, people just feel like infection should have a look.
Exactly.
You just see one girl and she has... Right?
Actually do
So you can actually see someone and say, this one, infection. this one will have it. You can just look at someone and say, no, we'll pass hepatitis, this one. I mean, it is very important because people feel like they need to itch, they need to smell in a way. So I've had to have random talk with people and I'm like, at what point do you think you should have an STI check? And they go like, I mean, when I go down on her, she smells funny. I'm like, there are chances that when you go down and she's not smelling funny, you feel like everything is cool and clear. So it's important to know that some of these things are asymptomatic and people should really get. I mean, do you want to weigh in on that as well?
I think it will save you a lot of stress, money especially. Because when you get to keep stay for a long time without doing this checkup, and then you reach a chronic stage that is complicated, you have to do lots of treatment, you're going to spend more.
Yeah.
So
right.
if you had done this check earlier, you would have maybe found out and then found a way to stop it on time. But when it progresses to a stage that you have to be constantly on antibiotics or antiparasitic drugs, then I think it should be a cause for alarm. You have to, because it save you that money, save you stress of thinking, okay, should I not,
Okay.
and all that.
And then even when you're treating it and when you feel like you've identified and when you feel like, okay, you've done what you're supposed to do, what are the long-term effects? I'm seeing Tunde today and I've seen Tunde and I've gone to do a test and I'm treated. Are there repercussions for leaving this untreated or treated? I don't know if you understand my question. So obviously you can actually say, okay, so what if I keep treating for STIs all the time? So why don't I just stay? You know, I want to be Randy. You just take permission. I say, oh Lord, you know, the life I gave you, give me 6 months. You don't want to go into the world. So you now go into the world and say you want to stay 6 months, you know, and do the things you want to do, right? So they can gather the thing and test it at a certain time. So what was the consequence of leaving this untreated for a long time?
Of course, a lot of sexually transmitted infections eventually lead to infertility.
Right.
So if you think about that, you would want to ask yourself, do I want this in the future? And then if you say you're not treating yourself for a long time, maybe you want to explore, be adventurous, you ask yourself, is this for me alone or for me and my partner? Because when you find this out, you have to tell your partner.
Mm-hmm.
Because if you've treated yourself and you're still sleeping with the person that is infected, it's like reinfecting yourself.
Great.
So you just have to.
So it has to be two-pronged
Yes.
approach. You guys have to.
Yes.
So Dr. Owoeye, is there a consequence for treating consistently? You know, when you say, but I just treated last week. You now treat again next week. You now treat again next 2 months. Let's say you are a very active person. Okay. So is there a consequence of always treating and then you pick up something and treat it? Do you feel like at some point, the reason why people don't want to treat all the times that they don't want to treat and your body will stop responding to treatment?
Well, I think one of
is there anything like that?
Yeah. One of the things you could actually get from consistent, treatment, especially with antibiotics, is antimicrobial resistance. Antimicrobial resistance could develop resistance to antibiotics, and there's a new concept now, especially with gonorrhea. Is giving a lot of people headaches. You have gonorrhea infection that's actually resistant to antibiotics. Even the second, third generation cephalosporins, which that's what you probably will resort to after you have actually used your fluoroquinolones and what have you. So I've actually seen a patient like that before, that we had to resort to treating with, I think, a third generation cephalosporin, like for 2 weeks in a month, and like 10 to 14 days in a month, and then we keep doing that every month. You understand? And so, yeah, that's one of the things you actually could get, because when you have, it's actually a global issue, resistance to gonorrhea. It's actually a global issue, and then we are beginning to see, a lot of that. So it's very, very important for you to. And the reason why people probably get to treat, that frequently is because most of the times when they treat, they self-medicate.
Oh,
so they just start treatment.
So they go to make and say, can I mix
exactly, and then they start treatment. Maybe you're having a discharge or itching. You start your drugs, your medications rather. After 2 days, the itching is gone, discharge has gone, and then you stop taking
discontinue
medication.
the medication.
So that actually invites, resistance too, because bacteria has to survive too. So if you give them the chance, they will develop genes that will resist.
That's serious. that's scary and serious, because the thing, just like some people will quote in the scriptures, should we continue in sin that grace may abound? Sometimes you feel like, okay, I treated it, as long as there's treatment, like you said in the first session. So I can treat this week, treat next week, treat the week after, treat. So as much as there is grace or there is treatment, I don't think it's something you want to do all the time. So obviously protection is expedient. It's important that you protect yourself and don't expose yourself, And so if I'm going to, I don't know if you want to add anything to it. early detection, effect of leaving anything untreated or treated. I don't know if there's something else you want to add before a round of.
Yes. Generally, STIs, they don't behave the same way in both sexes. Not every time.
Okay.
Sometimes they come up with different complications with different men, different genders.
Yeah.
So, in addition to infertility, which is a major issue for women.
Okay.
It's a long-term complication for STIs in women.
Okay.
For men, you're with bacterial STIs, chlamydia, gonorrhea, you're probably looking at urethral stricture.
Okay.
And that can become a problem.
Okay.
Because the condition itself makes it very difficult to pass urine, to ejaculate properly, to experience life normally. So you definitely want to ensure that it doesn't get to that point. And recurrent infections with chlamydia or gonorrhea could also predispose to that, because the idea is that while the urethra, that's the passage of urine, is infected, it's causing some scarring, right?
Oh.
That scarring would just build up over time, and eventually you have, from some strictures, that is abnormal passage, or abnormal different buildup of the urethra. And eventually, urine just comes up different.
Oh my goodness! I
And
mean,
that unfortunately, is another breeding. It's like a proper environment, right, for more infections to come up.
Oh,
right. And we're not just talking about STIs now; we're also talking about urinary tract infections.
Oh, great.
So that's a major one.
To round up this session, very key points that we mentioned: the importance of early testing. Obviously, you want to save costs, because when you let it go and then it advances to a stage, it becomes chronic. And I know, like the case of HPV, you can have other forms of cancer results in which I don't believe anybody wants to have that. So important to treat early, treat your partners as well. To avoid even life-threatening things like infections, recurrent infections, infertility issues, and all of that. And even then something that we're always overlooking is constant treatment. So there's a repercussion to treating, and there's also a repercussion for not even treating. So it's the devil at the deep blue sea here. Yeah, as much as we want to have you treat all the time and ensure you're fine and ensure you detect early, we also want you to protect yourself, because for each time you treat, there are also underlying healthcare issues that can come. From what Dr. Tade and Dr. Owoeye has explained. So it's important that we stay protected. Protected sex is still the way to go. And prevents recurrent health issues, basically. Thank you guys for doing justice to this topic. I wish everybody hears this and is threatened enough to not risk it. Yeah, thank you.